Welcome everybody for joining us today at this session. It's an online webinar where we're going to get an introduction to the GHIAA, the Global Health Innovation Alliance Accelerator MapGuide Equitable Access Toolkit, which is a very practical resource that's been designed to help those working at the intersection of innovation and access to medicine as well. Today, we're delighted to be joined by Julia Weiss-Barnes, who will be walking us through the toolkit and what it offers as well. I first encountered Julia on a Licensing Executive Society webinar, I think back in 2021, where she was on the panel talking about access to the technologies and intellectual property and the licensing of the intellectual property that was involved in developing the COVID vaccines, right? The other participants of the webinar included BioNTech and some of the other universities involved in technology licensing. And it was a real eye-opening to the complexities and the speed with which they effectively worked in order to get and enable access. And at the time, I was thinking to myself, how do we enable everybody else to effectively have access to a similar workflow or approach, in case we have health innovations that are being developed all over the world, that can be manufactured or sold or developed or wherever, to reach the actual intended user and make the intended impact that we all want, we all intended it to make. So the toolkit was developed across a wide range of professionals, including biotech companies and researchers. It's for research managers, tech transfer professionals, and contracts managers as well. And it's there to help the understanding of how agreements and partnerships can be structured to support sustainable and affordable access to medical products. I'm going to let Julia present on the toolkit and introduce it in a second. I want to welcome everybody again. We at Innovus Stellenbosch University have a number of technologies that has been funded by development finance organizations, as well as building on many years of research. One of them one collection I'm going to put in the chat is for TB-related technologies that you can get off our InPart website as well. These technologies are definitely intended with equitable access in mind. So you can have a look at those as well if you would like. And there are a number of technologies on our InPart website that you can have a look at that's designed for equitable access at Stellenbosch University. Julia, I did my bit. I'm going to hand it over to you. I apologize. I also wanted to introduce Brady Telford, who's also part of GHIAA and part of the team as well. Brady supports access to toolkits and that sort of thing. And the structure of the presentation and the webinar today is that Julia will go ahead and do her presentation. And then you are most welcome to post questions in the chat or in the Q&A, and myself and my colleagues at Innovus are going to monitor those. And then once Julia is done with the presentation, we'll basically address some of those chats as well. Okay, over to you, Julia. Thanks.
Thank you for the introduction, Sabra, and for the invitation to join Stellenbosch in hosting this webinar. The importance of achieving equitable access to health products has never been greater. And we, like most of the global health community, have been involved in more and more discussions that explore the role of each organization involved in the innovation, licensing, development, and commercialization of these products and importantly, enabling timely and affordable availability to them for all the patients who need them. So let me take a step back and explain why GHIAA provides, because I imagine that I don't know the majority of you. Over the past month, actually, I've been having a number of flashbacks to 2014. As many of you will remember, the Ebola outbreak that began that year motivated several efforts to accelerate vaccine development through a number of R&D consortia involving multiple organizations, from big pharma to nonprofits and institutes. And at that time, I had just started teaching at Duke University in North Carolina in the US, and I was putting together a course and really a program for an initiative that involved students from undergraduates through law students, learning how it's expanded to meet the needs of underserved populations globally. And as I read the announcements of the initial partnerships, I wondered not only whether adding more players to a group could accelerate the process, but also what would be the main impediments to doing so. As many of you know, it can take a year or more to negotiate an agreement. Parties together could accelerate the process. So program at Duke, I interviewed many of the organizations and stakeholders involved in those consortia, and we identified a set of common issues that most of them were facing. We then actually started to look for global health-related agreements and resources that included provisions meant to address those issues. So the results of those efforts became the initial MapGuide. In order to turn this academic project into an easily and openly accessible database of agreements that negotiation, in 2017, I spun the work out into the nonprofit company GHIAA, which is the Global Healthcare Innovation Alliance Accelerator. Had to be academic, right? Because so many words. Since then, we've developed the open access MapGuide platform, which contains a number of resources and tools to support the organizations who wish to achieve equitable access to the medical products that they fund, develop, manufacture, or commercialize. So today, I'm mainly going to focus on our newest resource, which is the Equitable Access Toolkit, including our guidance on equitable access plans and planning. What is the MapGuide platform that we talk about? I will go through a number of these a bit later, but as I said, focus on the Equitable Access Toolkit. So first, let me just give you a brief overview of all of the MapGuide resources. The provision database is where GHIAA and the MapGuide started. You'll see that up at the top left, I think, of your screen. So our database now contains an analysis of over 1,600 provisions from about 140 global health agreements. Moving on to the glossary in the bottom right corner, that the purpose of that glossary is to support and understand through shared terminology, because one thing we noticed, especially in negotiations, companies, universities, funders often use different terms or use the same terms to refer to different things, or vice versa. And so if you look at that, you'll see an explanation of the terminology often used in these negotiations and discussions of policies. So finally, let me say that Equitable Access Toolkit is our most recently launched resource, and I'm going to discuss it next. Their QR code is the lower corner there, so do scan it now or later so that you can actually look at the details. The Equitable Access Toolkit is meant to provide practical guidance to those involved in global health agreements, wherever they are in that process. We created the toolkit, converting the content of the provision database into a more accessible resource for a broader audience, not just lawyers. I will talk about some of the toolkit content in the following slides, but again, have a look at the QR code if you want to have an in-depth look. And I think what we'll start with next is the chain of agreements which can be involved in developing the product and making it accessible. This slide is actually adapted from one of the commentaries in the toolkit, which explains some of the types of agreements that are often involved in product R&D. So let me talk about each of these agreement boxes, a bit what they mean and the partners that can be involved. And hopefully some of this will resonate with where you all in your organizations. So of course, there are agreements from the time there is discovery through preclinical, clinical registration, distribution. So throughout the development chain, and as you will see, for most of that process, there are going to be R&D funding agreements. Funding comes from somewhere. So those agreements, after that initial license agreement that is below there, from that discovery, University Stellenbosch, of course, license out the technologies often to companies. They begin that R&D funding agreement or funding process often before they get that license, so to enable them to move forward with their development. That is often the first license and the first development agreement that happens. But again, as you know, collaboration agreements continue to happen upstream through registration, through distribution, and into clinical trial manufacturing and commercial manufacturing. As part of that, there's additional license agreements as part of material transfer agreements. And there's a lot we could talk about for material transfer agreements and that whole process, but that we'll save that for another day. Advanced purchase agreements, probably nobody even knew what the term was until COVID, that wasn't sort of closely involved in those things. And a little bit the same with procurement agreements for those that are outside the kind of procurement process. But my main point is that the very much impact the later agreements that come. So if the license agreement from the university, for instance, contains access provisions that requires that next developer to include those in their process, and as they pass them forward to future developers and manufacturers, it is much more likely that that product will make it to all the populations that need it. So start early. Sort of the first message, start early in considering access from that very first license throughout the process of all of, because they're both build on each other. The access commitments, therefore, should go throughout from the very beginning until the end. And I'll talk later on about access plans, but obviously what you know can be a commitment. Is quite different at the beginning of the process versus when you're about to commercialize the product. So let me move on to our equitable access period. Hopefully some of you have seen this before, and some of you might have actually gone through and looked at some of the blocks here and what lies below them. We developed the equitable access pyramid as a way of thinking through agreement provisions at different levels of depth. These blocks are the considerations that any group that wants to achieve access through the development of that product should consider. Of course, every one of these blocks, these terms, and the provisions that go with it don't apply to every agreement. So we'd like to say these are considerations, things you should look at as you are preparing to find partners and negotiate agreements. The three layers give sort of first, if you click on one of these blocks, you'll get a brief explanation of what the term means, followed by examples from the map guide. And finally, for those of you that actually like to see the agreement in its wholeness itself, you can click through and look at the agreements that the examples come from. Of course, the content and the context of the agreement is crucial for determining, as I said, which blocks are relevant and the type of provisions that are appropriate for each agreement. Again, if you haven't played with this yet, the interactive version on our website lets you click on each block in this pyramid and then go through to those different levels. But I'll show you a couple of examples, so static examples of what you might get to in a minute. I just wanted to first point out, I always think this pyramid is a little bit upside down in a way, because we normally think about the base of a pyramid as how you start to build the pyramid. But as you look at our equitable access pyramid, what starts as the top are the equitable access objectives. So that a product be available, affordable, appropriate, you can look at our definition, and sustainable. And then below that section are what we call the access provisions. These are really the provisions in an agreement to achieve access specifically. So there'll be the access principles for the agreement, what the parties are trying to achieve, the scope of the agreement, what they cover. Many of you will have worked with target product profiles. I won't read through the rest of these, but I'll give you a couple of examples that I think might be particularly interesting to you. And I've already mentioned an access plan, but we'll go through that in more detail. What I do want to call your attention to is the supporting provisions, or the base of this pyramid. So all of those things above are incredibly important to access. But if you can't enforce them and you don't have a mechanism for continuing those obligations throughout development, it's unlikely that the product, again, will reach all of those that need it. Part of that, of course, is reporting and audit, and dispute resolution, and then the governance of the collaboration itself. So now let me show you a couple of examples. Everybody wants to ask about pricing. So starting with pricing terms and affordable pricing commitments. This is a diagram, again, adapted from the toolkit. It will pop up again if you click on that block in the pyramid. There are obviously different types of pricing commitments. For instance, if you're a funder, you might be funding the development of a product, but at the end of the day, there is a formula or a description of what the maximum price can be or how pricing will be determined. And if you're doing a joint development with another party, you might be talking about the same thing. For instance, if a public-private partnership and a company are working together, they may also be the kinds of commitments that they expect around pricing in their agreement. I won't go through again this slide because you can go through it. I point out that there are some obligations versus fixed or more indirect approaches, and the appropriate terms, again, depend on the agreement context, which includes the stage of the product development and the partners and the product. So I will encourage you to actually, again, look through the rest of this for funding agreements and license agreements on the QR codes at the bottom. What we'll talk about next is intellectual property. I will try to speak a little bit more slowly, so if there's a gap, hopefully my voice will catch up. So looking at intellectual property rights management, we thought this audience, especially those of you from university tech transfer offices, but also companies, might be particularly interested in this subject. You can see again that this diagram is adapted from what we've got on our website, and it covers ownership and protection as well as licensing and tech transfer. So the kinds of provisions that you need to address, for instance, in IP ownership, background ownership of IP versus foreground or what's created during the project, and then sub-licensing and tech transfer, also I'm sure of interest to you, what is actually permitted, and are there sort of conditions on that? I know I'm repeating myself, but again, this is contextual. Depends on what type of agreements you're negotiating or drafting and which partners you're actually negotiating with. I'm going to move on to talk about access plans. Access plans have been widely discussed lately for a number of reasons. But let me start with the general purpose of an access plan, at least as we see it. It's on agreement access provisions by providing an evolving description of the development and commercialization activities that support patient access to an end product. So from beginning of development through to when it's going to be shared, it's going to obviously expand from what's known about the product at the very beginning, not much perhaps, to an increasing number of commitments to understand the product. So the access plan can be linked to agreements as an attachment or incorporated by reference in another way. But again, the important thing is that it's meant to evolve over the life of the agreement. So times can be set in the agreement when access plans are to be updated. So let's say it's in preclinical when it starts. So perhaps when the product goes into the clinic, an access plan, you move into phase 3 and you know the cost of goods, you know more attributes about the product, then the access plan should be amended. So the point is, again, it doesn't have to have everything in it from the beginning, but it should evolve as the product evolves so that you know what you need to reach the patient and what the obligations of the parties are in developing the product. An affordable, by the way, I wanted to mention an affordable access plan is now often, I won't say often, more than it used to be, included in many university licenses, such as the University of California at Berkeley, University of Michigan. And I should mention that the U.S. National Institutes of Health, their innovations, when they license them out, require an access plan from the licensee saying how they're going to overcome any impediments and develop the product to reach the populations that they have said they intend to reach. Again, access plan framework is actually in our materials, and the QR code is on the slide. And I can't finish this presentation without an acknowledgement that when we talk about agreements, we're talking about something that is negotiated between two or more parties. So I'm going to move to this and say much of what we talk to people about and consult with parties about is how do you actually develop a negotiating plan that covers the different elements that I've mentioned above. What is doable, what is sustainable from the considerations we've discussed. So how do you begin to think about the plan? Again, many of you are negotiators. These are the sort of the key questions. And so it is putting the access obligations that we've discussed and that are in the pyramid. How do those fit in the goals and in the context of the agreement? There may be funders that, have some leverage in negotiating it because they're putting money in. There may be an IP owner that has leverage because, of course, the licensee wants it. So how do you include access plans and use your leverage to get what you need to have out of it? So what's a must-have and what can you actually commit to. So I think I will stop there because I've been talking, I think, on what I'd like to hear is questions about the blocks that we think describe the different access components and perhaps determinants.
So we're going to take a couple of questions now. Feel free to post them in the chat. But I've got a question just to kick us off as well. Julia, you mentioned that the toolkit includes examples of actual agreements and provisions from GHIAA's database. Can you talk about the sources of the agreements and any changes you've basically encountered in getting organizations to share their provisions? Note here, I think in South Africa, we refer to like the provisions as sections effectively in the agreement as well, right? So yeah, can you tell us more about that?
Yes, I will say that, of course, even from the beginning, there have been challenges in getting agreements. So as I mentioned earlier, we have quite a few agreements and very many provisions now. They are, I think, all now publicly available. Well, publicly available for sure, because we have an open access website and the agreements are on there. So if you're a scientist, what you should think about with those agreements and provisions are that they are the data. They are the materials that underlie everything we've built in the MapGuide. So, over the years, there've been pushback sometimes from companies or others. This has never been done again when somebody asks for an access provision. So part of the reason to create the MapGuide was to show these have been used in agreements. We want to look at the kinds of agreements and say there's a way of searching the MapGuide to look at, say, agreements between universities and companies and for early stage versus late stage. And they will take you the provisions that are used for the different issues as for your contract all the way down to the contracts themselves. So everything, if you will, the Equitable Access Toolkit is built on top of that database and is meant to perhaps enable those that are in policy or not so involved in the negotiation of agreements to look at the definitions, brief descriptions of how things work without needing to go to the agreements. But we will say that most of those agreements come from either public filings they've had to file for tax reasons, or their government requires them to publish the agreements, or, for instance, can never say medicines. All of their easily searchable as well. And I think it has brought I'll say the level of the practice of equitable access up as people have seen what is actually used in these different agreements. But we are always looking for additional agreements, additional equitable access provisions that your organizations have negotiated to add into the MapGuide. So yes, please send more agreements that we can include. Thanks.
And so how do you manage like the sort of confidentiality around certain conditions or who the parties were in the in the agreements? Have they been redacted?
Some, often the agreements are redacted for commercially sensitive information. Of course, we encourage parties to through commercially reformed lawyer myself. I know lawyers tend to keep everything confidential. It's just a kind of a knee-jerk reaction, if you will. But in often there's plenty of provisions in those agreements that relate to access that don't need to be redacted, and also it should be for the benefit of the parties, because they are, in a sense, showing that they have an intention to make the product available to those that need it One we're sort of advocating for right now is for funders and others to not include the access obligations in the definition of confidential information. So in other words, again, the ways in which people achieve access through their agreements can be more widely known. And of course, selfishly, we want to add that into our database so that we can build on that and see if there are new practices evolving that that parties would be interested in knowing about.
Awesome. Thanks so much.
I
think Annie's got a question.
Yeah, so two actually, but the first one is from Marilise Richter, who says, "Thank you for the interesting material." And the question is, do any of the processes discussed include a commitment of engaging with ethic committees to ensure population level benefit sharing is included in ethics clearance from the start?
I think there are a number of policies for that fund how that of the criteria that I think were in your question. It probably goes to appropriateness. And there's a section in the MAP guide that talks about that. So, you know, what is appropriateness? You know, for instance, should target product profile, in particular, often a WHO never mind, TPP, be included, and how does that evolve? Sure. So, agreements, a lot of the PDPs include also that requirement, and that's part of the development plan overall for them when they're working with a commercial company. Did I answer your question?
I think so.
Yeah. Julie, I think it also has to do with, you know, whenever a bit of research effectively needs to be done, then researchers need to apply for ethics clearance effectively at the universities as well. The ethics committee and the role of the ethics committee is really important in trying to ensure that access does happen, equitable access does happen from the patient's perspective. So I figured that the MAP guide is a means to effectively ensure that the parties can negotiate access as well. So I imagine that the MAP guide toolkit would be quite a resource, a beneficial resource for from an ethics, a clearance perspective as well, right?
Yes, see if I'll try turning it on for a second. Yes, I hope so. I think everybody, and maybe that question was originally because there was recently a proposed trial considering the patients as whole, but the gathering for perhaps product other than in that country. I'll be general about that. But yes, absolutely important. And again, I know that isn't often funders' agreements, and certainly part of the criteria that there has to be sort of ethics approval before the trial starts. And I don't think we've particularly called that out in the MAP guide, but it's an interesting thing for us to look at. And I think it also ties into what we would call end-to-end access planning. And we have some resources in the MAP guide as well, which is essentially, you know, how do you match up the access plan that maybe a developer and a funder might put together along the way with the end-to-end access planning, which takes into account what the needs of the population are, and you know, whether, for instance, you know, the country health ministry is even interested in that product and what the characteristics would be. So it's really trying to kind of match those two things up. And certainly the ethics of where the clinical trial is done and who benefits from that. That I think public development partnerships and funders are concerned about, and I think it should be an inherent part in that end-to-end access. Am I soundless again?
No, we can hear you. I've switched off the screen, so the incoming video, so that should help us. We have a really nice question here also from Hashim Marika. He says the MapGuide dataset annotates publicly available contracts, but a significant share of vaccine TTAs, for example, the state enterprise direct models like Sinovac and Sinopharm, are sourced from press releases. How does the MapGuide team assess equity provisions in agreements where no binding instrument is publicly accessible? Is there a methodology for flagging these as structurally distinct from annotated agreements?
I will answer you briefly, and then I see Bridie is on screen, so I'm going to let her talk about methodology. But we don't
Okay.
make up provisions from press releases. We only take provisions from agreements. We note them, we watch for agreements, and we are interested when we find the agreements and compare them to what releases do not guide. Bridie, you want?
Yeah, I think I'll repeat some of what Julie said, but I think you were cutting out there as well. So yeah, just to confirm, our provision database is only based on agreements, whether they are signed agreements or model or template agreements, but we do not include items in the provision database that are sourced solely from press releases. Sometimes in writing up our annotations or our explanations of those agreements, we use information from press releases to kind of supplement the context of the agreement, but the provisions themselves are always actual agreement provisions.
Hashim has another follow-up question around the architecture of agreements and the common language also used in agreements and common understanding as well. Bridie, I think this is where the glossary actually may be really valuable, right? So that people who do access, the clauses within the agreement, the provisions within the agreement, actually have a common understanding about what each part is effectively trying to achieve, right?
Yes, that is the objective. We're always thinking of more things that we could add there, and also thinking about more ways in which different parties might interpret the same term and kind of trying to draw that together. So always happy to take extra input there. Just reading through Hashim's question there.
Yeah.
Also maybe just to answer the point about kind of distinguishing agreements that actually resulted in durable technology transfer.
Yeah.
I would say we have not to date managed to kind of do that testing of the kind of lasting impact, if you like. It is something we are very interested in looking into. And again, it is something that we are advocating that the organizations involved in those agreements do more of, to be more transparent about the kind of fulfillment of commitments made and the impact of them. With publicly available data, it often becomes quite difficult for us to kind of trace that through.
Yeah, I can imagine. So look, I wanted to touch also on the access plan and how practically it effectively can be used to ensure that everybody's on the same page, right? How have you guys seen it being used practically?
Julie, do you want to take that?
I will start, and if my voice cuts out, Bridie can pick up. I kind of have been describing it to people who've never even heard of an access plan as kind of a sandwich with the access plan in the middle, because almost every company has, right, a development plan for a product, and they
Yeah.
have a commercialization plan. And the access meant to reach the population would, so to in the beginning, how you're going to maximize the number of patients you're going to reach, where they're needed, where it needs to get to reach, and what the characteristics, as we said, sort of appropriateness. So I think that the access plan is really to bring kind of a meeting of the minds between those that are developing it and funding it and are going to need the product at the end of the day. That's at least how we think about access plans. But was there an additional question?
Brady, do you have anything else to add, maybe?
Yeah, sure. I could add some from the kind of practical how we see the plans being used. I would say we have seen some of the indications of how the plan can be used to kind of bring together the thinking of the parties involved directly in an agreement. But I think there's also a broader component to that, which is by thinking about the kind of thinking about what is needed to ensure access to a product and what the barriers are to ensuring that access, thinking about the other parties or stakeholders that need to be engaged somewhere in the R&D and commercialization process. By using the access plan, I think it can be a tool for kind of bringing together that broader stakeholder input and engagement as well in a timely manner, so that you don't kind of get these gaps in progress in product development.
Yeah. I mean, yeah, go ahead.
One other thing I was going to say is again, kind of echoing some of the things that Julie mentioned earlier, something that is important to that going forward is transparency. So some access plan provisions in agreements require that at a certain stage of product development, a non-confidential version of the plan be made available so that it can be shared more broadly with relevant stakeholders or with the public in general. Again, this helps everyone to get on the same page about what commitments are, what actions are needed, and who is responsible for what.
I can imagine that access plans can also be really beneficial to funders, for example, like maybe the Gates Foundation, who, prescribe access to global access to technologies and the projects and the research that they effectively that they fund. So if two parties were effectively going to agree on the terms of an access plan, say it was a university and a manufacturer of a technology, then submit that to a funder, that could actually serve as a really good tool to ensure that there's alignment as well with regard to the commercialization.
Exactly.
Yeah.
And thinking about kind of the forward thinking on the commercialization pathway and what other kind of funding might be needed to kind of move that pathway along.
Charlotte Masirumule has asked the question also around whether access plans consider the discrepancies and context in public versus private healthcare sectors in various countries. Thanks, Charlotte, for that question.
I was just going to say, I think that's part of the defining of your patient population. Where do you need to reach it? And if the purchases are different in different ways, how are you going to sell the procurement channel? Have you got Gavi providing it in some countries, but it's going to be government purchases in another, or a combination? So I think it is, again, who is it, starting with the end in mind, where are the patients that you need to reach, and how do they get those products? And we see, even right now, talking about sort of outbreaks, reaching patients, with Ebola vaccines is quite a different context than trying to reach a more standard included in sort of pediatric program medicines in a country where they have the channels pre-established. So I think, again, it is so product and patient specific.
One question that I also have is when agreements break down on access provisions during negotiation, what are the sticking points you see most often? And do you have examples of how parties basically work through them as well?
I think
Like the hard sticky points, yeah.
in the map guide were probably initially what we saw as sticky points. So, for instance, access to intellectual property, especially if it's platform-based intellectual property. There might be the owner of that and maybe the developer of the product may be fine with sharing a product that is needed for a smaller market with the developer as supported perhaps by a funder. But if the transfer of that IP to enable it to be made in a region where it's actually needed could, what should I say, weaken or damage their IP position, I think that's something that organizations, companies are most concerned about, because let's say you're an oncology company, but you've also developed something for pandemic flu based on that platform. You, again, might be willing to develop and provide that product, but it's going to be a harder ask to say, we want you to share that with regional manufacturers of our choice. That's often handled by saying, does that manufacturer have a trusted partner or a way, or somewhere that they could transfer it to if it's needed, if they themselves cannot or choose not to go forward with it. I would say that's probably one of the issues, one of the beginning issues.
Yeah. I mean, if I can just share also, I was part of a access negotiation for healthcare technology developed in South Africa, where the funder was trying to pull together the value chain of manufacturing and a decentralized value chain, manufacturing value chain as well. And one of the things that we actually found very useful is to go back to the funder and ask them, listen, so, have you had any interesting discussions lately with other potential manufacturers that you would like us to consider licensing the technology or the manufacturing capability to, right? And that was really helpful as well, because sometimes, it's the funders play different roles other than just, providing the capital in order to develop the technology. They're also trying to line up the value chain, right?
Yes.
And that in itself impacts licensing and which rights you're effectively licensing to whom under whatever conditions, right? So I can totally relate to your example there.
Yeah, I bet. And, as far as sort of practical ways, I mean, I've seen both lists attached to agreements that had trusted manufacturers, as in the technology could be transferred to them, as well as lists of two. So it can be handled in a couple of different ways, depending on who the owner of the technology sees as sort of either the most capable or the most risky partners.
Yeah. I mean, in South Africa, we also have the IPR Act putting the university where the technology is effectively being developed as the responsible party to ensure access, especially to South Africans when it comes to licensing as well. What can you say about, the impact of sort of like government BIDO kind of like legislation as well on these sorts of negotiations, and how companies are open to accommodating those sorts of provisions?
I see we have like 2 minutes, so I have to talk really
I
fast
know.
about this one. So I think it's very important for governments to show a leadership role here. And in looking at the pandemic negotiations around 9.5, requiring governments to actually develop a system of looking out a way to make them available. And so I think countries can help support both through incentives and hopefully not so much through disincentives, but incentives for companies to develop things that are needed both within their borders but also outside their borders. And so I think, sometimes that discussion gets so focused on pricing, and pricing is certainly important, but I think availability is maybe more important. Is the product available at all? So, for instance, in the it is very difficult to incentivize companies to develop things unless it's shown that there's some pull through and an incentive and purchasers at the other end. So I think it's really a chain, but governments are really play an important role here. And for another conversation, we can talk about how it's working in South Africa.
Absolutely. So with that, Julia, I want to thank you for the presentation and the introduction to the MapGuide Toolkit. And I also want to invite everybody else to a follow-up webinar that we're having on the 13th of July. We're going to send out a link to that webinar to everybody who's registered for this webinar. And we're going to ask you to promote that as well. We're going to host a panel discussion of people who have been impacted by collaborations, multinational collaborations, and who are basically going to share their experiences around negotiating access to healthcare technologies as well from their perspective by technology companies as well as funders. So look forward to that on the social media and in the email. But I just Julie, a closing remark, and then we can say our goodbyes.
Please feel free to share questions going forward, and I think my slides will be shared afterwards. And so thank you to everybody who attended, and we look forward to further discussions and to hearing your input onto the MapGuide and the toolkit. Thanks so much.
Thank you. Thanks everybody for joining. Cheers. Bye-bye.